Hello, hello. Welcome back to my corner of the internet. Welcome to this week's live training. I am happy to be here. I'm happy that you are here to listen to the things that I have to say. I really do enjoy sharing my thoughts and my ideas about the rehab world with all of you. So thank you again for coming. As always, my goal is to share tips and advice to help you build a career that you love that also avoids burnout so that you can enjoy both your career and your life outside of work. So, today we're going to be talking about non compliant patients because the frustration of non compliant patients can certainly lead to burnout in the rehab world. So, I'm going to be talking about why patients might be non compliant and what you can do about it to help make life a little bit easier for you. For anybody new here watching, I am Dr. Jody Miller. I'm a physical therapist and mentor to PT students and new grads, newer clinicians. I've worked in just about every setting there is for PTs, and now I own a cash based practice in Florida. So I've worked in acute care, I've worked in outpatient, I have done home health, I've done pediatrics, oncology, travel therapy. I've worked a lot in skilled nursing facilities. I've been a rehab director in a skilled nursing facility. I've also done lab assisting and adjunct teaching in PT schools. And like I said, now I own a cash-based practice here in Florida where I work mostly with gymnasts and cheerleaders. And I'm also the owner of Clinical Connections Mentoring, which is where you are today. So what I like to do, if you are watching live, please go ahead, type live in the comments. Tell me who you are, where you're watching from, and just like to know who I'm talking to. But if you're watching the replay, same thing. Go ahead, type your name, type replay, tell me who you are, where you're from. Also, while you're there in the comments, I want you to drop one word that describes how you feel when you see a patient on your schedule that is non-compliant. Like, what's that feeling you get when you pull up your schedule in the morning, you see that patient, and it's the non-compliant patient? How does that make you feel? Go ahead, drop that word in the comments. For me, that word is frustrating, right? That's the first thing I think of. Oh gosh, there's that patient again. And I just feel so frustrated. So, as rehab professionals, we put a lot of effort into providing individualized care and developing effective treatment plans, right? So, when we put all of this work in to help our patients, then the patient's non compliant, it can be really frustrating, right? It can feel like the patient doesn't care, or the patient doesn't want to do the work, or they're just lazy, right? This is especially hard and true for new grads, right? Because newer clinicians, you want to be able to help everybody, right? You want to be able to help everybody that walks through that door. You want to be the one that makes a difference for that patient. You want to show your boss that you know what you're doing. You want to show your coworkers that you actually know what you're doing. You want to show the patients that you know what you're doing. But when you end up having a non-compliant patient on your schedule, you start to question things a little bit, right? You start to think, "Ugh, if I just knew the best exercises, then I could help this patient." Or if they would just do what I'm telling them to do, they would get better. Or if they just came to all of their PT sessions and stopped canceling appointments, then I'd really be able to help them. You start to think that, but then what happens is then you start to question yourself. Why aren't they coming to therapy? Do they not like me? Am I not doing a good job? Right? Who here is a clinician who's watching? Give me a thumbs up, wave your hand, whatever. Drop me in the comments if you've ever thought any of those things when you have that patient on your schedule. So you can see how this can cause like a snowball effect for newer clinicians, right? And let me tell you, this does not just happen for new grads. This does happen to seasoned clinicians as well. So I want you to know that anybody that waved their hand, gave me a thumbs up, whatever, you're not alone, right? These same thoughts and feelings do happen to a lot of therapists, regardless of how long they've been in this field. But that being said, there are some things that you can do to help with these feelings and some things that you can do to help with those non compliant patients. That's what we're going to talk about today. So, the first thing to realize and recognize is that you cannot and will not help every patient. Now, this doesn't mean that every patient falls into a compliant or non compliant category, and we're going to come back to that in a second. But it does mean that physical therapy just will not help every patient, right? Some people actually do need the surgery. Some people just won't respond to the best PT interventions in the world, right? It's not going to happen for everybody. So if you can start to understand and appreciate that PT is not the answer for everybody, then this can kind of help to lessen that stress that you've placed on yourself that you have to help everyone. Okay. The next thing to realize is that patients are not non compliant. We need to just take this word out of our vocabulary, and we definitely need to take it out of the rehab world. Okay. Patients are not non compliant, they just aren't getting what they need in that moment. Okay. We need to meet the patient where they are. Let me give you an example. Let's say we have a patient coming into PT after 6 months of shoulder pain. They rate their pain at a constant 8 out of 10. They're no longer using that arm. They've stopped doing all the activities that they like to do, like cooking, gardening, and they're even having trouble with all their ADLs. You do the eval, you find some just generalized weakness, nothing terrible, just general weakness. They have full passive range of motion, but limited active range of motion because of pain. As a PT, you know that exercise and movement is the best for this patient. So after the assessment, you prescribe 6 to 7 upper extremity exercises of about a 5 pound weight and tell them to do them a couple times a week. At the next session, the patient comes in, they say, yeah, I didn't do the home program. It hurt too much. And I really just couldn't find the time to do the exercises. Sounds frustrating, right? We know that the patient needs to move that arm. And if they do the exercises, they'll feel better. And if they don't, the pain's going to continue to worsen, right? We know that as therapists. But let's go back and look at that situation again. So first, this patient came in with a really high SINS level. They're very limited on a lot of tasks and are reporting high pain levels with a lot of their tasks, right? So this tells you that you need to have a low entry point into their rehab program. You can't come in guns blazing and be aggressive with this patient. If you do, that patient is not going to buy into the treatment plan that you've created, and they're going to appear non-compliant. But it's not that they're non-compliant, they just aren't ready for what you were giving them in that moment. They're not ready for a bunch of exercises with 5 pounds of resistance, right? This patient needs a slower, more gentle starting place, right? Things like basic but creative forms of active range of motion where they're in control of the mobility and it's done in pain-free ranges of motion, gently pushing those boundaries of discomfort, right? It's not just we're going to stay here in this pain-free range. You do need to move into that range of pain, but gently pushing that boundary. This will let them feel in control and more likely to buy in what you're telling them. Okay. Next, same scenario. Giving them 6 to 7 exercises for their home program on day one is just way too much, and it's really overwhelming for a new patient, especially a patient who's got 8 out of 10 pain and it's been that way for 6 months. Okay. We know research shows that about 3 exercises is enough. Patients are more likely to complete 3 exercises in their home program than 7 exercises. And again, these 3 exercises should be creative range of motion tasks to get the patient to feel comfortable with movement again, then start to trust what you're telling them. The next thing to consider is your prescription. So telling a patient to do their HEP a couple times a week, it's really vague, right? A patient is much more likely to perform the program you've created for them when you give them very specific instructions. So for this patient in our example, start with, I want you to do these every day. If they feel good and they're not painful, then you can start to do, I'm sorry, let's start, tell the patient to do them every other day. Then if it feels good and it's not painful, then they can start to do it every day, right? So that's a lot more specific than just do it a couple times a week, right? Be specific in what they are allowed to do, what you want them to do, what they can do. Just be specific here, okay? And last, for this example that we're talking about, you need the patient to buy in to what you are doing, to buy into the physical therapy that you're providing. For example, a good way to do this is to end that eval with just some gentle manual techniques, right? So showing the patient how much range of motion is possible for them, showing them that movement is not a bad thing and showing them that movement can actually be helpful for them. And it doesn't just have to be manual techniques, right? Remember, for this patient, think simple and pain free. Have them do some simple self mobilization tasks to show them that movement and mobility is safe. When you show the patient that they're safe and they're allowed to move in pain free motions, and that you know how to show them how to do all of this, that's when they start to trust you. Okay. When the patient trusts you, they buy into therapy and they'll do what you're giving them to do. Okay. So we need to meet the patient where they are. We need to meet the needs that they have at that time. Okay. Another way that a patient appears to be non compliant is when you are not on the same page as the patient, right? So, this again, meeting the patient where they are. So, most patients actually do want to feel better and be able to do more, but you have to know what that is and you have to match that, right? Meaning you need to know what they want to do and what their goals are. So if you assume a patient wants to get back to running marathons, but all they really want to do now is just run 5 miles, then you're not on the same page, right? You're way up here and the patient's down here. It's not going to work. So if you're creating a treatment plan and giving them interventions that don't meet their goals, the patient's going to appear non-compliant because that wasn't the plan that they wanted. So what do you do here, right? The answer is communication. You have to ask the patient what they want and you create the treatment plan around that, right? You might think that they're capable of doing more. You might think that their goals are too simple, but it doesn't matter what you think. What matters is what the patient thinks and what the patient wants. So, your job is again to meet the patient where they are. Okay? Let me give you an example. Just this week, I had a patient come to me who had seen multiple physicians, they'd seen a chiropractor and two other PTs before they came to me. Not one of them asked her what she wanted or what her goals were. None of them knew that what she wanted to be able to do, which meant that no one told her that those things were possible. So she actually just felt stuck and was scared that she wasn't going to be able to do those things that were important to her anymore. Nobody asked her what they were, and nobody told her she could do those things. So it's really important to communicate with your patients. Ask them what they want and meet them there. Then allow them to contribute to the treatment plan. This will give them some ownership in what you're going to have them do, right? When the patient's able to help with the creation of the plan, or when the patient has just a really good, strong understanding of what the treatment plan is, then the patient's going to buy in to what you're telling them to do. It'll mean more to the patient and they will be much more likely to participate in that plan because they were a part of creating it. Okay. Additionally, with communication, the patient will tell you what they want in terms of treatment interventions. Listen to the patient when you are taking their history. They will give you the information you need. If the patient has responded to specific interventions in the past, those are the ones that you should prescribe. Let me give you an example. Patient comes to you for knee pain. During the history, they say, I had to go to PT last year for my hip, and I did not like it when the therapist did like massage type things and pushed on my hip. It always just made it hurt more. This is information, and you need to pay attention to that. This tells you to stay away from manual techniques for this patient. They're not going to respond to it. They didn't like it before. If you jump into performing manual techniques on their knee, they're not going to trust you or buy into what you're doing. They're going to be like, she didn't listen to anything I said, and they're going to appear non compliant. So, communicate and listen to what your patients are telling you. They will tell you what is most important to them and what they will respond to. Next, I want to talk about some of those tougher situations. So sometimes we hear things from patients, and maybe not sometimes, maybe a lot of times, we hear things from patients like, oh, I'm just here because the doctor told me I had to come to PT. Or I have to fail PT, then I can get the surgery that the doctor says I need. Or my insurance won't pay for my MRI until I try PT first, right? Wave, give me a thumbs up, drop a me if you've heard some of those things before. So these types of patients are much harder nuts to crack. Okay. Oftentimes, these patients, They've already come in, their mind is made up about PT. They've come to the eval already thinking PT is not going to help them. It's just that step that they have to take to get what they actually want or what they think is going to help them. Okay. I'm going to say it is really hard to change somebody's mind, especially when it comes to things like pain that they've been feeling, especially if it's chronic pain. I'm not saying it's impossible, I'm just saying it's harder. So, for these types of patients, you can start with all the things that I've mentioned so far. Meet the patient where they are, start at the right entry point to their rehab program, ask them what is important to them, communicate and involve them in the process of creating the treatment plan. Then see what happens. You may be able to change their mind, you might not. And then this takes me to the last point that I want to discuss. And that is that you can't want it more than the patient does. When a patient comes to therapy, it's about them, not about you. It's about what they want, not what you want. So if you want an outcome more than a patient does, the patient is going to appear non-compliant and you're only going to get frustrated. So yes, we've done the learning, we've completed the education, we've read all the research. We know what is best in terms of interventions for optimal outcomes for our patients, but that does not mean that it applies to everyone and that's the same for everyone. Their current experience is not about you and what you want for them. It's about the patient and what they want for themselves. So, like I said multiple times today, you have to meet the patient where they are. When your starting point is too far down that rehab road, or you push the patient too much, or you drive them to meet your goals, the patient's not going to trust you. They're not going to buy into what you're telling them, and they won't do what you're telling them to do, either because they don't understand why or because it's just too much for them at that moment and they're gonna appear non-compliant. Instead, meet them at their entry point to therapy, meet them at their goals, meet them at what they want out of therapy, meet them at what is important to them. Okay. The end result will be a patient who completes their home program, who does actually want to get out of bed when you show up in their hospital room. You'll get a patient who shows up for all of their appointments. You'll get a patient who's actually excited to work with you, and a patient who achieves their desired outcomes. And yes, there will still be those really tough patients. So if you've done all of these things, you've met the patient at all of those places, and they still aren't following your guidance, remind yourself that people are allowed to make their own decisions. People are allowed to say no to things. People are allowed to decide not to follow your advice and your guidance. You have to give people that autonomy. And then you just respect their choices and their decisions. You are not responsible for other people's choices or actions. You're only responsible for your choices and actions. So if you do still have those tough patients, try reminding yourself that you did everything that you could to help them. You did the best you could. You gave them all of the information that they needed, and they made the choice. And if it's not a choice that you would agree with, that's okay. They're allowed to make that. Let it go, and you move on to the next patient. Okay. It is very much easier said than done. That is something that does take some work and some practice to do. But if you can really focus in on that and remind yourself they have the right to make these choices. I've done everything that I can. They made the choice. I'm going to let that go and I'm going to move on to the next patient. Okay. When you're able to do all of these things that I have mentioned today, then suddenly your schedule is going to be full of compliant patients that you enjoy working with, and you'll see your frustration levels really start to come down. Okay. I hope you learned something new today. Please go ahead and drop um, your aha moments in the comments. Something that really stood out for you, go ahead, drop that in the comments. Something that you learned, something that really just inspired you, sparked you, whatever. I want to thank you for watching, whether you're watching on Instagram, whether you're watching on YouTube, or whether you're watching in the Clinical Connections Facebook group. Thank you again for coming. If you have any questions about what I talked about today, please feel free to message me or leave your questions in the comments. I'll come back and answer them. I'll see you next time. Have a good day.